Hey guys, Aaron Kasner, Doctor of Physical Therapy. Today we're going to talk about what is physical therapy. So if you haven't experienced it yet, you know what to look for, and if you are experiencing it now, you get to kind of check and see if you're getting quality therapy. All right, so physical therapy is kind of a paradox. It's a bunch of things, and it's really just one thing. That one thing is trying to get you back to normal. Now, what is normal to you? It's different for everybody, right? So it could be getting back to playing a sport, it could be getting back to work, it could be playing with your grandkids, it can be a ton of things. So PT needs to be catered to what you need specifically. Now, this is where we use a bunch of things. There's tons of different treatment options that we can use. There's different modalities, there's different exercises, there's different manual therapy techniques, there's different just overall treatment plans, and they should be different. Physical therapy isn't a cookie cutter type of medicine, which is a great thing, right? It can be catered to exactly what you need. Now, on your first day for physical therapy, they're going to ask you a bunch of questions. This is the part where we're trying to get all the information possible. It's up to you to paint the best picture that you can in order to tell us kind of what the problem is, what's been going on, the different levels of pain, what causes your pain, things you're getting back to, everything about you and your experiences. Because that allows us to be able to decide what the best treatment method is for you. Now, you get to help decide with that treatment method. It's not just going to be do these things and you'll be better, I promise. No, we got to work together. You got to talk to me about the things that you're desiring, the things you want to get back to, your interests, so we can kind of form it together and mold it so it fits you perfectly, so it gets you back to your normal as quickly as possible. After you paint a really good picture of what's going on, then we're going to check some positional things. So we're going to check and see what your posture is, kind of see what you look like when you're sitting versus when you're standing, and then kind of transform that into movement. So seeing how you move, seeing if there's any compensatory patterns, if there's anything where you're moving in maybe not the best way possible, and that way we can see what we need to do. That'll determine where the impairments are and how we design your treatment. Once we have figured out the different patterns or different movements that are occurring that we need to try to fix, we're going to test your range of motion and check your strength. So from there, we get to see where more of the specific impairments are. So maybe you're really weak through your rotator cuff, or maybe your glutes aren't kicking in when they should. We find out if that's the case, and then we fix it. We give you an exercise. We give you education, trying to explain to you what's going on with it. That way you have a better idea. Other things that we'll test, we'll be checking ligaments, checking tendons and joints and seeing how your joints move, making sure everything's moving in the right way that they should. Now, if you're post-op, meaning you've just had surgery, we're probably going to do things a little bit differently. If you're fresh out of rotator cuff surgery and you're in a sling, I don't want to be testing your strength. First off, you'll hate me for it. You're not going to like if I'm pushing around on your arm that you just had worked on. But it's also not going to be good for your tissue. We have tissue healing times that we have to wait for before we can progress a certain amount of things. That is why it's so important if you're in a sling or you're in a brace that you wear it exactly as doc told you to wear it. We don't want to be out of that sling and moving it around, because then what if your tissue doesn't heal all the way and then you end up re-tearing it? You have to have surgery again, go through all of this all over again. So we don't want to do that. Make sure you're adhering to the protocol. Make sure you do what you're supposed to be doing in the terms of wearing the sling, wearing a brace, or not overusing your body. When you come in post-op, we're probably going to check a few things differently. Like, we're not going to check your strength. I'm not going to really check your range of motion too much, depending on what surgery you had. If it wasn't a lot of things going on with no tissue repairs, I may test, I may not. Like with a total knee replacement, I could test you the day you come in because everything's been cemented down. Everything is nice and stable in that joint, which is why you're able to walk on it right away. But because you're in a lot of pain, I'm not going to get a true test of your strength because you're going to be hurting and you're not going to want to see how hard you can really push it. Your pain's going to shut it off and you're not going to be able to push any harder. And that's okay. I don't need you to. I don't need to know what the strength is currently. I know it's not going to be great because you're in pain. So physical therapy is a lot of things, and it's only one thing, right? I'm getting you back to what you want to do. If you don't have ambitions to be a professional football player, I don't care about you trying to cut one way and cut the other way. I don't care how your body responds to that. There's no need to test it. But if you're a high school athlete and you're trying to continue with your sports career, you're playing your senior year, you want to go to college or whatever it is, and you want to be able to do those things, we are for sure going to do those things. I want to make sure we do exactly what you need and get you back to where you were before you had your injury. The most important thing that should be consistent in all physical therapy appointments is education. We as physical therapists need to educate the patients so you guys know what's going on, so you know what to look for and you know what to expect. That way you have a game plan for yourself and we work together in order to be able to get that game plan set, okay? So what are you going to be having physical therapy for? Let me know in the comments below and maybe we can communicate a little bit about what to expect and some of the things that you can look forward to. If you liked what you saw today, hit that subscribe button. Check out my other videos I have in this PT series, and there's going to be more to come, so stay tuned.